Hi, my name is Dr. Laura Gill-Sealy and I am one of the pediatric orthopedists at Pediatric Specialists of Virginia. Today I would like to talk to you about the care of Spica casts. Typically, there are two uses for Spica casts. The first is for developmental dysplasia of the hip or congenital hip dislocation after the hip has been surgically reduced or redirected into the socket. Typically, the cast is worn for about 6 to 12 weeks, with a cast change at 6 weeks. There are several different types of Spica casts. It can include a single leg with a pelvic band. It can include 1.5 legs as shown here. It can include both legs with a long leg cast, or it can include both legs but stops above the knee on both sides. These casts have a waterproof lining and a cutout both at the front as well as the back for diapering and hygiene. Either during surgery or after surgery, we petal the cast with a waterproof lining or duct tape. And this is done in order to prevent or reduce soiling of the cast. The tape may be reinforced. If the tape becomes loose or partially destroyed, I would recommend reinforcing rather than removing, as it may tear the lining of the cast. For hygiene, you will need 3 things. You will need an incontinence pad, you will need a small diaper, and you will need a larger diaper to go on the outside of the cast. First, you will take the small diaper and remove all 4 tabs so that the finished product looks like this. You will take the incontinence pad and stick it on the inside of the small diaper and then use this to tuck inside the cast. So we take baby and we tuck the small diaper inside the cast. What you don't want is to have the diaper on the outside of the cast, as this will cause soiling. So we tuck the diaper in all around. It is okay to reach inside the cast if you have enough room in order to pull the diaper up. You may turn your child over so that you can tuck the diaper in the back. Remember to tuck it on the inside all around. Like this. Again, it's okay if you have room to reach inside and pull the diaper up from the inside. Finally, we take the outer larger diaper, we open it all the way up, lift baby, and this is applied on the outside of the cast for additional reinforcement and absorption and to hold everything in place. It is important to change the baby regularly in order to prevent soiling of the cast. In order to do this, you remove all the diapers make sure you get everything out. You will use a wipe or a damp cloth in order to clean the edges of the cast like this. If the cast itself is soiled, you may also wipe the cast clean. Prior to discharge, you may need to be seen by an occupational therapist or safety specialist in order to determine if it is safe for your child to travel home. You may need to purchase a special car seat with an open style in order to accommodate the cast. Sometimes a special harness is required to strap the baby into the seat so that the baby may travel safely home. Dressing may be a challenge, but several options are available. You may use a t-shirt or a dress. One of the best things you can use is an oversized onesie. It is pulled down over the cast and clasped in the middle. The advantage of using this is that the child cannot stick or food droppings may not get inside of the cast. For positioning, the baby may be placed in a bean bag or reclined chair at a greater than or equal to 45-degree angle. When flat, it's important to put a blanket under the baby's legs for support. It's okay to turn the baby from side to side for positioning. I would just use a rolled up towel under the baby's back to ensure that they're comfortable. It is okay to do belly time, however, this must be supervised as the baby will have limited mobility in the cast. Spica tables can also be purchased online, and this allows your child to sit for activities as well as meals. Thank you so much for watching. If you have any questions or concerns, please don't hesitate to contact our office.